Sometimes government does something and we always hear bad things about it. But here's something which scholars are praising. There was a tax credit given for child tax credit and parents' mental health improves. Well, what else parents like other than money? We have a scholar, Professor Rita Hamad. She is a physician and the director of social policies for Health Equity Research Program at University of California, San Francisco. Welcome to Muslim Network TV.
Thanks for having me.
So tell us, what was so unique in 2021 child tax credit?
Yeah, so the policy that we were looking at was the child tax credit. And for those of you who haven't heard of it, it was a major income support program that was passed during the pandemic. Basically, Congress was concerned that there was a lot of economic hardship and that families were struggling. So they expanded an existing program, which is the child tax credit. So usually the child tax credit, you file your taxes. It's for middle income families usually, and it's up to $2,000 per child. But in 2021, they expanded this program. It was up to $3,600 per child. And instead of waiting until tax season to get your refund, people started to get the payments on a monthly basis from July to December of 2021. So it was about $300, up to $300 a month for each child. And Congress also expanded the eligibility so that you didn't have to be a higher earner to get it. You could even make no money. Even people who were unemployed were able to get the tax credit. And also, the child tax credit, unlike a lot of other safety net policies in the US, is available even to immigrants as long as the child has a social security number. So, we were looking at how this tax credit affected parents' mental health. And we were using a large data set from the US Census called the Household Pulse Survey. And we found that compared to people who didn't have children, parents had a big improvement in their mental health after this policy was put into place, improvements in depressive symptoms and in anxiety symptoms. And these improvements were the largest for people with the lowest incomes, who were the ones who were newly eligible and getting the largest benefits.
Well, it's not very often that people can correlate a government program with the mental health of people. Is there any precedent of these type of research and studies before?
Yeah, actually, my team has done some of this kind of work before where we've been looking at the effects of the other major US poverty alleviation policy. That one is the Earned Income Tax Credit. Again, it's another program that you have to file taxes to be able to get the benefit. That program is only available for people who work, and that one is restricted to people who are citizens or permanent residents. And for that policy as well, my team and other people who have looked at that policy have seen that it improves mental health. In general, sometimes it can be hard to study these policies, but we were able to find a data set that asked about mental health and that covered this time period, so we were able to answer that research question.
Well, does it mean we can generalize more money the happier you are?
Yeah, you know, it's surprising that's not always the case. There have actually been studies of the lottery, so people who buy lottery tickets and sometimes get millions of dollars. There have been studies that have looked at those people a little bit after they get the money and find that maybe in the first weeks or months after getting the payment, their mental health improves. But then even though they're still getting those payments, they go back to whatever their usual is. So there's something to be said for how we deliver money to people is important. Like maybe one big lump sum at one time is not as helpful. That's how our tax refunds usually work, is one lump sum. So this study is suggesting that if you give people the money more regularly, that's actually better for them. And a lot of times in the US, the money often has strings attached. Like for the Earned Income Tax Credit, you have to be working. For a lot of the nutrition programs in the US, like SNAP, which is also known as food stamps, you don't just get cash, you get money specifically for food. And so, if your family needs cash that month for housing and not as much for food, maybe it won't do as much for your mental health. So that's sort of, people often tell me, oh, the result of your study was very obvious. But in a lot of cases, we find that the policies aren't working as we would expect, or that they're not benefiting the people who we really want the funds to be going to, or that the policy is really hard to apply for to get the benefit. This is like a tax credit, so it is a little bit technically complicated. So yeah, so In general, probably we could say getting money is good for mental health, but the details really matter when you're trying to design a big, complicated government policy.
Well, but the point which you are noting is that it is not the lump sum money, the large sum of money, but the consistent level of reliable income increase, which is helping in this situation. Is that correct?
Yeah, we think that's part of why we saw that mental health benefit. Some of the, previous work on the earned income tax credit, which again is just a once a year payment, most of those studies find a positive mental health benefit, but some of them question that. And some of the thinking is maybe because it's too infrequent, it's not that helpful. So yeah, I mean, and in the US, we don't have many other like no strings attached cash payments like that come on such a regular basis. It's actually more common in other countries. Other high income countries tend to provide cash benefits for families with children with the understanding that this is an investment in the country's future, that children shouldn't be penalized for the families that they were born into, that everybody deserves some minimum amount. And so a lot of other countries do provide these more frequent monthly payments. It's just not something that we did in the US other than this temporary expansion of the child tax credit.
Which are those countries in the West where this idea is coming from that providing some funding on the regular basis could be helpful for citizens?
I don't have a list of them off the top of my head. I'm pretty sure that Canada offers that, or at least they did it for a more extended period of time, and a lot of the high income countries in Europe also do that.
I remember at least one presidential candidate in the last election cycle in early days committed $1,000 for every citizen. I don't
Hmm.
know how far he went. He didn't go very far, but
Yeah.
that idea has popped into our discourse. Do you think you will have opportunity to present your finding that a consistent level of income support helps parent? Do you think you will be able to get invited to congressional hearing on this topic?
If anybody invites me, I'd be happy to go. I think we'll see what happens with the current Congress. As you know, it's a split right now. The Republicans have control of the House, and the Democrats have control of the Senate. So they might not agree on a lot of kinds of policies. I like to say that the child tax credit should be a policy that policymakers could agree on because it supports family values. It's an investment in children. Again, policymakers argue about the details. There's some discussion that maybe the child tax credit reduces people's employment, like because you're getting money with no strings attached, maybe you're going to work a little bit less. There have been studies that have looked at that and saw that if the child tax credit does reduce employment, it's only by a little bit, and that should be weighed against the benefits, like the mental health benefits that we saw in our study. Other studies found that the child tax credit reduces food insecurity. So that's something that Congress will debate, and even if there's stalling on this issue by the federal government, state governments in the U.S. actually can also act on this. I live in California. California has something called the Young Child Tax Credit, or YCTC, and that's similar but not exactly the same as the child tax credit. It's the same idea, providing an extra boost for families with the youngest children. And so states can act even when the federal government cannot. So I think it's definitely a possibility in the future.
Well, thank you so much, Dr. Rita Hamad, for your time. Truly appreciate it.
Yeah, thank you so much for having me.